All right, today we are jumping into some really fascinating and frankly long overdue research. We're looking at the first major survey that explores what actually happens when people with bipolar disorder use psilocybin, the active compound in magic mushrooms. This is a huge deal because from a research standpoint, this has basically been a forbidden topic until now. And that brings us to the big, almost radical question driving all of this. Could a psychedelic, a substance that's been historically walled off from this entire patient group, actually turn out to be a helpful treatment? A team of researchers from UCSF and UBC decided it was time to find out. So, yeah, let's get into it. So, here's our roadmap. First, we'll talk about why we even need new treatments for bipolar disorder. That's the treatment gap. Then we'll get into the whole psilocybin question. After that, we'll look at the survey itself, what people are actually experiencing out there. We'll weigh the risks against the benefits they reported, and finally, wrap up with how all this crucial info helps us design smarter, safer clinical trials moving forward. So first things first, why is this research so critical right now? Well, it all starts with a major gap in how we currently treat bipolar disorder. There's a real, urgent need for something new. Okay, so bipolar disorder affects about 2.5% of people around the world. And while we often think of the manic highs, the reality is that patients spend way more time in the depressive phase. And when you ask them, they consistently say that the depression is the absolute hardest, most burdensome part of the illness. It's what's linked to an inability to function and, tragically, to suicidality. And here's the problem. The tools we have right now are, well, they're pretty limited. Our standard treatments, things like lithium or antipsychotics, can have some really tough side effects. And if you try to use standard antidepressants, you run the very real risk of actually pushing someone into a manic episode. So for many, many patients, the current options just don't work well enough. And that's exactly where psilocybin enters the conversation. Here you have a compound that's showing all this promise in other areas of mental health, but for people with bipolar disorder, it's been strictly off limits. So this is the core dilemma, right? It's a real scientific cliffhanger. On one side, you have psilocybin therapy looking incredibly promising for major depression, for anxiety, for addiction. But on the other side, if you have a bipolar diagnosis, you've been completely excluded from all of these studies. And the reason has always been this fear that it could trigger mania. But here's the thing. That fear has been built almost entirely on old case reports and anecdotes, not on solid, systematic data. So to finally get some of that solid data, researchers launched the first ever international online survey on this. The whole point was to move past the stories and start looking at real evidence from a large group of people. What they did was survey 541 adults who all said they had a bipolar disorder diagnosis and had also taken a full psychedelic dose of psilocybin at least once. The average age was around 34. It was pretty evenly split between men and women, and most folks were from the US. This became the first big dataset of its kind ever collected. Okay, so let's get into the good stuff. What did they actually find? Well, the results are not simple. They paint a really nuanced picture, with some very clear risks, but also some pretty significant benefits that people reported. You have to start with the risks, and they are real. About a third of the people in the survey reported some kind of negative effect. And the number one issue was, just as feared, new or worsening manic symptoms. That happened to about 14% of them. After that, you see trouble sleeping and anxiety. So the takeaway here is clear. The risk of making symptoms worse is absolutely something we have to take seriously. But, and this is a really important but, we have to put that risk in context. While side effects were definitely reported, really serious events, things that required a trip to the ER or a stay in a psychiatric hospital, well, those were incredibly rare. It happened in only 3.3% of the cases. Now, let's flip the coin and talk about the other side of this. A lot of people describe some pretty profound benefits. And this quote here just nails one of the biggest themes they found. It's this idea that people felt they could better cope with their symptoms long after the experience was over, almost like they could access the memory of that psilocybin headspace and use it as a tool to calm down. And here's another huge theme that came up again and again, this feeling of deep psychological or spiritual growth. People talked about gaining brand new perspectives, about breaking out of that rigid, black and white thinking that can be so common in depression. And it helped them develop more self-compassion and work through difficult stuff. So when you ask them to weigh it all, how did it stack up? Well, on a scale of 1 to 5, where 5 is extremely harmful, the average score people gave was just 1.6. So even for those who had negative side effects, they generally didn't see the whole experience as overwhelmingly bad. And now look at this. In stark contrast, when you ask how helpful it was on that same 5-point scale, the average score was a 4. And that right there is the central tension of these findings. Despite the very real risks, on the whole, people found psilocybin to be way more helpful than it was harmful. Okay, so what do you do with data this complicated? The goal isn't just to look at it, it's to use it. These real-world experiences are now giving us the insights we need to build much safer, much more effective clinical trials for the future. This survey basically gives us a clear playbook for managing the risks. Future studies now know they have to carefully screen people for any early signs of mood elevation before giving them psilocybin. They need to make sure people are sticking to their prescribed medications. And, critically, they'll need really proactive follow-up calls after a session, and maybe even have some people stay in a facility for monitoring, just to keep a close eye on their sleep and overall stability. And all of this leads to one final, really important question. For decades, an entire class of potentially powerful medicines has been totally off limits to a group of people who desperately need new options, and it was all based on caution and a few old stories. What this research shows us is that by carefully and methodically collecting real-world data, we can start to actually measure both the risks and the benefits. We can build a responsible path forward. It really suggests that careful, patient science might just be the only key we have to safely explore and maybe one day unlock these controversial but incredibly promising medicines.